Welcome to week 10, and this week we are going to go through 3 different PowerPoints, basically 3 chapters in your textbook. So we're just going to jump right into it. Let me get my screen going here. So the first chapter we're going to start with is the Spirochetes chapter. Let me just put this into a slideshow here. Okay. So basically, spirochetes are a group of bacteria that are not coxy, they're not bacilli, they are spiral shaped. So these are really the only ones that we're going to talk about throughout micro 1 and 2 that are spiral shaped. So this is it. The majority of bacteria, when we discuss, they're either gram-positive or gram-negatives. These spirochetes are very movable in your body due to the flagella that they possess, and there's 3 clinically significant spirochetes that we're worried about. There's of course more, but these are the 3 genera that we are most concerned with. So Treponema, Borrelia, and Leptospira. Hopefully you recognize either Treponema or Borrelia's name, especially if you've taken immunology. You should recognize both of those, or at least one of them. So you'll see why here in a minute. But the neat thing is they are all spiral shaped, and the way that they spiral is actually differing from one to the next. Now they're spiral shaped. You can't look at this and be like, oh, that's tightly wound, so that has to be Leptospira with a hook end. Well, you can't just say that, but it kind of starts to give you an idea of what it would be. So as you can tell here, Borrelia is a lot more of a looser kind of coil, whereas Leptospira is more tightly, and it usually has like these hooked ends. And then Treponema is a little bit looser than that. All right, so we're going to start with Treponema. They consider it tightly coiled. I would say it's not that tightly coiled, but the big thing with Treponema is it doesn't stain well. So usually we're using a fluorescent dye with a dark field microscopy to really have it pop out at us against that dark field. You typically only culture this in cell culture. I'm sorry, my computer keeps giving me warnings on something, sorry. The major pathogens within Treponema are Treponema pallidum, Treponema pallidum pertinu, and Treponema caritium. The Treponema pallidum is the one that we should be familiar with, and that's the cause of syphilis. So let me see, if we go here to our nice little chart, it gives us exactly what each one causes. So as I said before, the first one, Treponema pallidum, is syphilis. So of course this is an STD. It's passed through sexual contact, or it's passed from mother to fetus, congenital. And there are different stages of syphilis. There's actually the primary, secondary, and late or tertiary stage of syphilis. Treponema pallidum pertinu is basically infected lesions. Is a disease called yaws that's more found in South America and in Africa, mainly in children. And then Treponema caritium is a disease called pinsa. It's also infected lesions. And again, Central and South America with that one. So in the U.S., we're more worried about the syphilis typically, unless somebody has traveled. So this is showing you examples of what those yaws lesions look like. They look really kind of similar to some of the other skin ulcer lesions that we've seen with the erysipeloid that causes skin ulcers. The bacillus anthracis can cause some skin ulcers, so we've seen a few things like this. All right, so let's discuss the stages of syphilis. I know that you may have had this in immunology. It never hurts to go back through them. So the primary stage of syphilis is always that shank, which is that genital lesion showing up. Now, if you miss seeing that present, you might have no idea you have syphilis. Hopefully people get tested on a regular basis. That's always the hope, but you never know. So hopefully they've seen that shank or whatever you want to call it on the genitalia area, and that prompts them to go in and obviously know something's wrong to get treated. Syphilis is very treatable, especially in that primary stage. When it gets to the tertiary stage, you're looking at it's done. The damage is kind of done then. So it's very treatable in the primary stage. So it can be up to 24 weeks while the infection is still disseminating within the body. Secondary syphilis, at some point the patient will move into secondary syphilis. This kind of has symptoms that resemble a lot of infections or diseases, so fever, weight loss, rash. Your skin especially is really heavily affected at the stage with that rash and sensitivity. And then the bacteria will kind of go latent. It'll kind of hang out in the body for a while, and it could be years down the road. You don't think anything's wrong, and all of a sudden it pops back up. And like it says here, even up to 25 years later, it can pop up into the 3rd tertiary stage. And this is where it really becomes deadly. It involves the central nervous system, so they have all sorts of mental health kind of issues that go with it, tissue destruction of these different, you know, this nervous system, and the cardiovascular, so your heart and eye problems, so you could go blind, things like that. I still remember there is, I'm a freak about Law & Order SVU. I love that show. That's like one of my favorite shows. I watch it all the time. There is an episode of Law & Order SVU where the suspect cut was acting totally mentally crazy. I don't know how else to describe it. He was just acting really crazy, and he ended up showing that he had tertiary syphilis. So it definitely affects your central nervous system at that point. All right, so diagnosis, again, ideally we want to see fluorescent technique on a dark field. That will confirm it, but there are a few screening tests that we can run, and this is when people do go to get their STD checks. They'll usually run one of these screening tests to check for syphilis, and then if either one of these screening tests are positive, then they'll confirm it with the fluorescent, actually seeing it on the dark fields down here at the bottom. So let's just go through these. The two screening tests are RPR and VDRL. RPR stands for rapid plasma reagent. Reagent is the type of antibody they're screening for. And VDRL just means venereal disease research lab. VDRL, just a special note, can be used on cerebrospinal fluid samples. RPR is not. RPR is more of a serum test. But VDRL can test on CSF, which works because if we're concerned about tertiary syphilis in the central nervous system, a CSF would apply there. So these are both flocculation-based tests. So in other words, they're like a precipitation method. So if you've been through immunology, you should be familiar that precipitation is basically when you have a soluble antigen forming clumps. When it binds to an antibody, it'll show up clumpy, and that's your positive answer. When you see that positivity, then you should right away reflex it to a confirmatory to stamp, yes, you truly have this. We want to see the actual Treponema spirochetes. So they will do what we call an FTA-ABS, fluorescent treponemal antibody absorption test. So this is where they're using a fluorescent dye, looking for that Treponema spirochete and looking under a dark field microscope. And so there is kind of what you can see. So you see the little spirochete. So many issues that it causes. All right, so that's what you need to know on Treponema. The majority is on Treponema pallidum there for syphilis. All right, Borrelia is a more looser coiled spirochete. This will actually stain with Giemsa stain, which is more used in hematology. It is the causative agent of Lyme's disease. That's why I was hoping you guys were familiar with this. Also causes relapsing fever. So again, to detect Borrelia, we can directly observe it, especially under the microscope. There's PCR testing. That's mainly what people do now is PCR testing. Everything is going that way. Or you can do an ELISA kind of kit testing. And ELISA, again, you should have learned about that in immunology. So Lyme's disease is specifically caused by Borrelia burgdorferi. I would remember that forever. And it is, again, passed through a tick. So very much something we should be familiar with in the Midwest, the New England part of the United States as well, Northwest, anywhere there's ticks. The Ixodes tick is a specific species of tick that passes Borrelia burgdorferi. So when somebody first gets Lyme disease, the first stage is they will get this erythema migrans, which is basically a target rash at the site of that tick bite. So where that tick was, they will get this rash that looks like a target, kind of like the store Target symbol. Now, not everybody gets that rash, but greater than 70% of the patients with Lyme disease will have that rash. So majority do get it at some point. They'll also see headache, fever, joint pain. Then it will go into the next phase, arthritis, neurologic disorders can involve meningitis, and then finally the third stage, which is chronic arthritis, which can continue for years and be quite debilitating and painful. Of course, it is a bacteria. We can try treating it and just try to get rid of it in the beginning. Not everybody has to go through the chronic arthritis for years. There are some that really have some debilitating arthritis. Relapsing fever is also caused by a different species of Borrelia, and this is called Borrelia recurrentis. The nice thing here is the names kind of go together. Recurring, relapsing, to me those go together, so it's easier to remember. And these are passed through lice. So the actual scientific name for lice is Pediculus humanus. So that's the vector for Borrelia recurrentis, and so humans are really the only reservoir for this bacteria. Once you get this, it's fever, headache, muscle pain, and then the bacteria can become really hidden, and then all of a sudden pop back up and cause another fever period, and then go hidden and pop back up and cause another fever. So you see why it's called the relapsing fever. It goes through kind of cycles. Leptospira is the one that had the hooked ends, and it's a corkscrew motility when it does move. Leptospira interrogans is our main pathogen we're concerned here, and it's a zoonotic infection. So it's coming from contact with the animal or contact with the animal's blood or urine. The bacteria will invade into the CNS, kidneys, and other areas of the body. So again, fever, headache, joint pain, muscle pain, some meningitis, so very similar features here to the other ones. There's a more advanced disease of this called Wales disease, in which you'll see a very severe illness with actual kind of your organs are not functioning properly. So it's the Leptospira interrogans only jacked up worse, basically. It's a more severe infection of it. Okay, a note on Vincent's disease. Vincent's disease is also caused by spirochetes, and these are spirochetes that are found just normally in our oral cavity or the genital tract, but more we're concerned with the oral cavity here. So this is causing basically acute necrotizing, oh, that word spelled wrong, necrotizing ulcerative gingivitis, essentially the breakdown of your gums. So it's what we say here, the destructive lesion. So it's kind of eating through the gums, so not pretty at all. All right, that's spirochetes. Really, it's just those three genera, Treponema, Borrelia, and Leptospira. So that's the nice part. There is only 3 genera to remember here. Okay. Oh my gosh, my computer's driving me nuts. All right, let's move into the Mycoplasma and Urea plasma PowerPoint next. Let's see. Okay. All right, so these two, Mycoplasma and Urea plasma, are very unique in that they are bacteria that have no cell wall. So obviously we can't gram stain them. If the gram stain targets the cell wall on bacteria, that's how we gram stain. If they have no cell wall, we cannot gram stain these organisms. And they are also extremely small little bacteria. They're tiny. So in order to grow these, they are quite picky. They are going to require agar that has cholesterol and fatty acids added to it. And then when they do grow, their colonies tend to give a fried egg appearance. So that's kind of what the fried egg is supposed to look like. So in the middle where it's darker, it was supposed to be the yolk. All right, so mycoplasmas are normal flora in our body. They're found in the oropharynx, upper respiratory, genitourinary tract. So you can get infections with these in kind of those same areas if they're allowed, you know, if they kind of have the opportunity to thrive up and take advantage of, you know, they will, and then they can cause disease, but overall they're just mostly normal flora. So Mycoplasma Pneumoniae is probably the more common one out of the bunch, and so obviously this is a pneumonia, so respiratory tract. Ureaplasma, ureolyticum, and Mycoplasma Hominis both cause infections in the genitourinary tract. So let's go through these. Mycoplasma Pneumoniae is called walking pneumonia. So maybe some of you have heard of walking pneumonia. Pretty much they have figured that walking pneumonia makes up about 20% of our pneumonia infections. Now remember, we did discuss that strep pneumoniae is the #1 cause of pneumonia, and it is. But walking pneumonia, there is a lot of it out there. They feel that actually 20% is a really underestimated number. The thing, what walking pneumonia is essentially you have the cough, you have the, you know, you don't feel good, you might have a slight little fever, mild fever, but you don't feel so crappy that you're in the hospital, most likely with this. You know, with most pneumonias, you know you have pneumonia. I mean, it's not fun, your breathing sucks, you know, you have a fever, you know you have pneumonia. With walking pneumonia, it's a milder form. They call it walking because you're still trying to make it through your day. You're like, I feel crappy, but I'm not crappy enough that I need to, like, go to a hospital or something. So you're kind of up, you're moving around, you're just trying to push through it. And so as a result, because most people just try to push through it, they feel like it's really underdiagnosed. So there probably is a lot more walking pneumonia around than we even realize, because people just don't really go to the doctor for it because they think, I can make it, I can do this. I mean, you don't want to pay a medical bill if you don't have to. So that's kind of what walking pneumonia is. So remember, that's what Mycoplasma Pneumoniae is. All right, Mycoplasma Hominis and Plasma ureolyticum, again, these are found in the urogenital tract, so they are associated with genitourinary infections like bacterial vaginosis. So let's get into it specifically. Mycoplasma hominis causes urethritis and pelvic inflammatory disease. Those are usually related with STDs. So I would say Mycoplasma hominis is an STD type infection. The only times we ever talk about urethritis is usually chlamydia or syphilis or something like that. So it's kind of an STD area. Plasma ureolyticum also can cause urethritis in males, can cause problems with reproduction for females, and can cause a congenital pneumonia if it's a pregnant female. So lots of genitourinary area kind of problems here. So to diagnose, Mycoplasma hominis will grow in blood agar and chocolate, but the rest of them really won't grow. And again, if you go to gram stain it, it's not going to gram stain because there's no cell wall. So typically, we use a lot of PCR to diagnose this, so looking for, DNA. If we suspect walking pneumonia, there's antibody titers that we can draw to look for the antibody to Mycoplasma pneumoniae. And then way back when, we learned acridine orange. That is a stain that will work on Mycoplasma and ureaplasma, because acridine orange targets nucleic acids. So it won't target the cell wall, it targets the nucleic acids in the bacteria, so that will stain the Mycoplasma and ureaplasma. All right, that's it. That's always a very short chapter. Also, I think we've already had this question, but just keep it in mind. When we're talking about these organisms with no cell walls, of course, treatment, you cannot use penicillin or vancomycin. Any of those treatments that target the cell walls will not work on these bacterial infections. So always just keep that in mind as well. All right, and then our last chapter is going to be some other special organisms that just kind of don't fit anywhere else. So Chlamydia Rickettsia and a couple others. So these are all grouped together because they are considered obligate intracellular bacteria, meaning they have to live inside of a cell to survive. So they're kind of similar to viruses that way, that they have to be inside the cell. As a result, you are not going to get these to grow out on agar like normal bacteria will. We use a lot of Pcr techniques, especially for chlamydia. You can use, I think I might mention a few here, but PCR is a big one. So chlamydia has 3 species, Chlamydia trachomatis, sweet, miraderum, and then there's a very similar genre called Chlamydophila that has 6 species, and you can see them listed. The ones that we are most concerned with are these 3. These are the 3 clinically significant out of all those species listed. So Chlamydia trachomatis, which is your STD chlamydia, Chlamydophila pneumoniae, and Chlamydophila psittaci. They are causes of human infection, not hymen. Oh my. So again, they are obligate intracellular bacteria, and their cell wall, even if you're trying to stain them, they don't have a peptidoglycan layer, so they're not going to really stain anyway. So again, Chlamydia trachomatis is the STD. It causes what we call pelvic inflammatory disease, so PID, so that goes along with this STD. It can also cause a lot of issues if it gets into the eye as an eye infection with conjunctivitis. It will cause blindness if it's not treated. So natural habitat is humans, again, spread through sexual transmission. It can also be spread congenitally, so it's always important to screen pregnant women. So specimen collection, we can do a urine sample and run that on PCR, or commonly we usually have the doctor usually sends a swab to the lab. And typically in the lab, we always run chlamydia and gonorrhea together. It's just 2 that we always run together on a PCR technique. But you can also look for, so that's what the direct detection of antigen or nucleic acid. Nucleic acid is referring to kind of the PCR technique. So there are some other techniques out there, but that's the main one that everybody uses now. Chlamydia Pneumoniae is all about birds. I always remember this one with birds. So whenever I see like pigeons and their poop, or I freak out because my little nieces and nephews' mom loves having birds, and she would let her kids be in the same water as the birds, and I'd be like, oh my God. And all I could think about was Chlamydia Pneumoniae. I'm like, that's so not right. Anyway, that's just getting off track. So this is a very big pathogen in bird species, so you're going to get it, of course, by handling birds, possible inhalation, you know, just something like that. Parrots and parakeets are a big one for it. So those are common household pets. They're cute, but they're not, they have disease. So Cynicosis basically is a disease you get, the infection you get from this. And it causes pneumonia, headache, a mental status change, and an enlarged liver and spleen. We will diagnose this through different serological antibody kind of testing. You really want to make sure you're using a high biosafety level so you're not like inhaling this at all. Chlamydia Pneumoniae, of course, causes pneumonia. So lots of respiratory stuff there, pneumonia, bronchitis, sore throat, pharyngitis, sinusitis. And that's all I'm going to say on this one. Again, same type of lab diagnosis. All right, on to some other obligate intracellular. Rickettsia is responsible for Rocky Mountain spotted fever, and it's passed through ticks. Orencia susugumushi, which is the best name ever, causes something called scrub typhus, which is passed through chiggers. If you guys are from the lakes area, you know what chiggers are. Likia is an organism that causes ehrlichiosis, passed through ticks. That is definitely one that's commonly found in Minnesota and Wisconsin, anywhere that there's ticks. We see that. And then Anaplasma is very similar to Ehrlichia. Basically, to me, it looks identical, passed through ticks as well. So let's go through, I did not mention Coxiella yet. So Coxiella is another organism that causes what we call a Q fever. This is basically a systemic infection, especially affecting the lung. It is considered a gram-negative coccobacilli. This one can survive outside of the cell. The rest of these have been obligate intracellular. This one can survive outside the cell. But in order to grow it, it's a picky little bugger, and it will only grow in the lab inside the lung cells that you're trying to diagnose. So it's very specialized kind of microbiology. You're not going to just find any microlab looking for Coxiella. That's kind of a send-out test. I can never pronounce this one. Treponema Whipplei causes Whipple's disease, which affects more men. So diarrhea, weight loss, enlarged lymph nodes, joint pain. So very similar kind of stuff to some of the other infections. But we can't culture this one either. Again, we would detect it with PCR. This one is another STD. You never knew there were so many STDs out there, did you? I don't believe I test you on this one. You can cross this out if you'd like. It's just informational. All right, so that is it. The only thing I will mention that I thought it was on here and it wasn't is I think all you guys have been through hematology. If not, I want to make sure I mention this. So at some point in heme, hopefully you learned about malaria, babesia, some of those other things. In that same chapter with hemolysis, there was a mention on Ehrlichia. So Ehrlichia, when we diagnose this, a lot of the stuff we've been using PCR, Ehrlichia can actually be diagnosed or seen in the blood smear. So when you do a blood smear and you're counting cells, you will see Ehrlichia bacteria inside neutrophils especially. So it'll be this round, little, darker stained inclusion inside the neutrophils in the cytoplasm. And that's what always spurs us to be like, oh, wait, that's not normal. You know, that looks like Ehrlichia. Anaplasma will look the same as well. Do you see how it says granulocytic? That's meaning those neutrophil cells. So that will also be seen in the cytoplasm. They look just alike. And a lot of times people don't even distinguish between these anymore. So again, pass through ticks. So just note that one of the best ways to see and detect Ehrlichia and Anaplasma is through a blood smear looking under the microscope. All right, so that is it. I think we're good for this week. It is our last week of lectures, which is awesome. We're almost there. So again, as always, please email if you need anything at all. Otherwise, have a fabulous week 10. Thank you.